กลับเข้าสู่เซสชันถัดไปนะครับผมเซสชันถัดไปเนี่ยก็จะเป็นการบรรยายเกี่ยวกับการใช้ AI นะครับเข้ามาในระบบhealthcare system นะครับผมแล้วก็ในเซสชันนี้นะครับเราได้รับเกียรติจากวิทยากร2ท่านนะครับที่จะมาเป็น moderator ให้เรานะครับท่านแรกนะครับเรียนเชิญดร.พัทรนุธาพรนะครับดร.พัทนะครับเป็น co-director ที่ MIT Advancing Human AI Interaction Research Program นะครับดร.พัทเนี่ยเป็นด็อกเตอร์หนุ่มไฟแรงนะครับเพิ่งจบPhD นะครับจากมหาลัย MIT นะครับอาจารย์เป็นPhD คนไทยคนแรกนะครับที่ไปเรียนในสาขา Fluid Interface นะครับที่ Media Lab จาก MIT นะครับและวิทยากรท่านที่2นะครับคุณหน้าคุ้นตากันดีตั้งแต่เช้าแล้วนะครับผู้ช่วยศาสตราจารย์ดร.นายแพทย์จิรวัตรสว่างศรีนะครับวันนี้อาจารย์ก็รับเป็นพิธีกรในหลายเซสชันเลยนะครับกราบเรียนเชิญครับ
Okay, welcome back to the next international session. Dr. Pat, please to introduce Dr. Chethan, please.
All right, thank you everyone, and welcome back to the session. So it's an honor and privilege to introduce actually my colleagues and my friend, Professor Chethan Sarabu from Stanford Medicine. Professor Sarabu is a clinical assistant professor and pediatrics and general pediatrics practice at Stanford Medicine Children's Health. Dr. Sarabu is trained in landscape architecture and also clinical informatics, which really bring together this interdisciplinary practice to advance the future of healthcare. And his talk today, I think, is going to be really exciting and going to be really futuristic. So please welcome Professor Sarabu.
And really excited to be with all of you today from across the world in New York. So I'm going to just share my slides. All right. Hopefully you can all hear me okay. My talk today is going to be called Centering Patients and Clinicians in Health AI. As you may know already, with AI, we're seeing rapid changes in healthcare with AI being implemented across the board, from more traditional machine learning, deep learning, predictive tools to now generative AI tools, large language models are entering all different types of uses in healthcare. And I'm going to talk about a few of them, but then really want to talk about what is the perspective of clinicians and patients, and how do we think about them in this new world of health AI that we're going into. I also wanted to start with one of the fundamental theories of informatics, which states that the human brain plus the computer is superior to the human brain alone. However, I think with a lot of the new work that's happening in health AI, it's starting into question, is the computer on its own better than the human brain? But I think we would say in medicine, so much of illness and healing requires the human touch, compassion, empathy, and understanding. And so I personally believe the human touch is still very vital, but a lot of our assumptions are being challenged by what AI brings. And so we're seeing transformation across many different areas of healthcare. So in diagnostics, we have a lot of AI imaging companies that have focused on medical imaging analysis. And I'm just naming a couple of companies just to illustrate examples here. I don't have any specific relation to any of the companies that I'm mentioning. But we see it for radiology imaging, pathology imaging, allow specialists to scale their diagnostic abilities to maybe get to more accurate results. And then we're seeing similar AI tools being used for treatment alerts. For example, there's a lot of work that's happened over the past 5-6 years really around sepsis prediction. Although with a lot of these predictive AI tools, the effectiveness of them is still quite mixed, because even if the tool can predict something, it then has to fit into an existing clinical context, which usually means alerting a human physician, clinical team that needs to act on that information. And if that information isn't sharing something new that clinicians didn't already know, then they're less likely to act on it. So we have a lot of work that's happened in AI-based alert systems for treatment, for early warning. But in terms of the actual utility of them in clinical care, it's still a little bit mixed. There's some signs of progress, but we still have a long way to go. Obviously, we have a lot happening from a patient monitoring perspective, from devices like the Apple Watch or Fitbit, and there's all type of AI algorithms that are in place to monitor more and more data, not just to monitor heart rate, but to be able to detect additional risks, such as the risk of falling based on these models that the companies are developing. And we also increasingly have AI-based chatbots that are being rolled out to provide care to patients, a lot in the mental health space, and a lot of AI-based remote monitoring. Because one of the big challenges with monitoring devices from patients at home or even in the hospital is with the large volume of data these devices generate, it's typically been hard for doctors to make sense of all of that data. And that's where AI has been promised to help turn a lot of that raw data, a lot of increased monitoring data, and provide more actionable insights. We're still, I think, in that process of getting there. There are a lot of examples of AI in surgery, from assisting robots to surgical planning, intraoperative guidance, also in procedure-based care like colonoscopies for looking for colon cancer. There's now AI-assisted scoping involved that I think many of you are probably aware of. And so and I just wanted to highlight many of these different areas. And then I think one of the hottest areas that we're seeing with AI adoption is across administrative tasks. The number one, which I'm going to talk more about, is medical documentation. We have a lot of AI ambient scribe tools that are now able to listen into a conversation between a patient and a doctor and to capture all the essential clinical details and to translate that into a note. Beyond that, these tools can also perform other administrative tasks like generating the appropriate medical diagnostic codes to be able to assist in scheduling. And so many health systems are rapidly rolling out these AI tools, even as they're still in development, testing, validation. And so my talk is really going to focus a lot more on generative AI, on large language models, and how they're being used in healthcare communication, because that's really at the heart of healthcare, the communication between a patient and doctor. And so what we see with generative AI is a lot of hype at the moment. We hear that ambient scribes can alleviate the burden of clinical documentation, which I know in the United States at least is a really big burden. I'm not sure of the extent. It's a burden in Thailand, but across many countries, the administrative capturing of all the healthcare delivery is something that AI promises to really help with, along with communication. And part of why this technology is really promising too is the ability to translate, not just translate across languages, but to translate medical concepts into more lay language for the average person to better understand their health. And that's really, as I said, I think the heart of healthcare is these very human relationships. It's the conversations when you're sick, you want to know that someone is caring for you, has your health in mind. But we also are starting to introduce all of these technologies into place. So there's this question of, can the technologies help us have better healthcare experiences where we actually feel more taken care of? And not just for patients, but also for the doctors and nurses and other clinical staff. We have really high levels of clinician burnout in the United States, of many doctors feeling like overwhelmed by the system and not really finding the joy and in the practice of medicine. And technology has been blamed as causing some of the problems, but there's also a lot of optimism that technology like AI, ambient scribes, can actually help alleviate the problem and actually bring humanity back to the practice of medicine. And I highlighted a lot of examples of how doctors might use AI, but what's interesting, particularly with large language models like ChatGPT, is that they're actually enabling a new level of patient empowerment. We're seeing stories like on the left-hand side, mother had her son had a rare disease. They saw 17 doctors for 3 years who couldn't come up with a diagnosis. But she was able to take all of that information, put it into ChatGPT, and ChatGPT was able to figure out the diagnosis. Now, these models like ChatGPT are not trained to be medical expert systems, but there are other large language models, such as the tools from Google, like MedPalm, that are more specialized and trained for medical knowledge. But we are finding that the general models are actually quite good, but there are still real risks of hallucination of the models maybe making information up. So there has to be a lot of guidance around this. And so I highlighted on the right a website created by a patient advocate, e-patient Dave, called Patients Use AI. And Dave has been highlighting a lot of use cases of how patients have been able to use tools like ChatGPT in their own care for diagnosis, but also to help fight bureaucracy around insurance and high costs of care in the US, and use AI tools to help empower patients in navigating the healthcare system. And so wanted to highlight these are just many of the topics that I have really engaged in a number of different forums. Most recently in Boston, there was the AI and Healthcare Forum organized by HIMSS, the health tech organization, and there's a lot of interest in how these technologies are being used by patients and doctors and transforming care. And to just tell you a little bit more about myself, I have a couple of different hats. I've been a clinical assistant professor of pediatrics at Stanford University over the past 7 years. I still am, although I have a couple of new roles. I'm recently transitioned over to being in New York City and primarily work across Stanford, but also Cornell Tech as a director of clinical innovation in connecting the dots between academic medical centers and new tech innovation. And then I also work for an organization called Open Notes that I'll tell you a little bit more about as an AI and informatics strategist. And just wanted to highlight some of the research that I'd done going into the space. A lot of my work had been around patients accessing their health information and how it empowers them, partly in the pediatric space, as well as looking at advances in AI. This is more work around predictive AI model development. I've been involved with developing computer vision based tools to be able to diagnose symptoms such as eyelid drooping and rare neurological conditions. I've been involved with creating predictive models to predict the risk of allergies, seasonal allergies for someone using more of their real world data from their smartphone. And so just wanted to highlight some of that background. And then most recently had the pleasure of working together with Dr. Padmanabhan, on a study that is going to be coming out in the New England Journal of Medicine AI edition soon. But just wanted to highlight some of the key points. So this is a study where we had used an AI tool, and this was an older version of ChatGPT. I believe it was GPT 3.0, where we generated responses to medical questions, answers to medical questions, had those rated by medical doctors. We also had responses by medical doctors to the original questions, and then recruited participants to rate their perceptions. And I'm not going to go into all of the details, but the bottom line is people trust AI-generated medical responses and view them to be as valid as doctors, even when they're rated to be low accuracy. And so it raises a lot of questions around the rise of AI-generated medical responses that are just available now on the internet for anyone to get to. And so this paper that will be coming out soon, will present all of our methodology, and hopefully it's an important call to more safeguards in this work. Want to just, on that note of where we need to help patients and doctors navigate AI, wanted to just introduce the work that I do at the Open Notes Lab, because this is really the heart of what we do. And it's not just me, we have an additional team for the Open Notes Lab, and there's also a greater group of researchers based around primarily around the United States, but some international collaborations as well. And really with the Open Notes Lab, what we're doing is exploring some of these and other questions. How might health information technologies be used directly by patients to improve their ability to engage in care? As AI transforms interactions between clinicians and patients, how do we help that it ensures that it builds trust and understanding and doesn't cause a worsening of the relationship between the doctor and patient? How do we make sure that AI supports doctors, clinicians, and service of patients? And how do we ensure that the algorithms that are used are trained and implemented in ways that respect the diverse needs and rights of individual patients, clinicians, that work to reduce bias that may be part of the training data, and ensure that the models are not perpetuating biases? And so wanted to highlight an example of the type of work we do. This is actually a very new partnership that was just announced 2 days ago. We have a partnership with Abridge. Abridge is an ambient scribe company, but we're going to be working together on a research project to evaluate AI-generated visit summaries for patients. So after a visit between a patient and a doctor, the patient usually has a lot of tasks that they have to do. They have to maybe remember to go get some blood work. They have to remember to pick up a medicine. They may have to change their diet. They may have to schedule a procedure. And it's often difficult for a patient to remember all the tasks they have to do. And so there's a lot of excitement now with AI being able to listen to what the doctor had recommended and generate those summaries for patients. And so we're exploring what that technology can do, and more importantly, we're actually involving patients in the co-design of this technology. So we make sure both patients and clinicians are part of creating this technology. And so the work of Open Notes goes back over a decade, and it is really about empowering patients in their care, but really not thinking only of patients, but really the experience of patients and doctors together. And what the research of Open Notes has found over the past 10 years, really 14 years across over 100 studies, is that the more transparent you are, if doctors share more of their clinical reasoning, their notes, the lab results, it actually leads to better relationships, better engagement, increased accuracy and safety, and patients are more directly empowered in their care. And the work of Open Notes really is an Open Notes, I should mention, is a nonprofit academic research organization. Through this research of transparency, has led to a lot of transformations across the US healthcare system, including some landmark laws like the 21st Century Cures Act law, which mandates that all patients have to have access to their full medical record, including all the test results and doctor's notes. And not going to go into all the details, but this spread over a decade, going all the way back to 2010, driven by a lot of research and saying patients should have access to their notes. And then now we're really going beyond the notes into what AI is doing, as I mentioned. And to zoom way back, what we're talking about with notes is this idea of at the heart of any healthcare visit, there's a conversation that a patient and doctor are having, and then that conversation gets turned into clinical documentation. And traditionally, and even now, most of the way that works is that the physician, clinician is listening to the patient and writing down the important details they think matter, not every word is captured, but what they think is important. But sometimes this leads to changes in understanding of what the information was. And so, for example, here in this conversation, there's a patient's mother who says that their son has not been feeling well, that they've been feeling really hot, and then that their body was shaking. The doctor interpreted this to be a febrile seizure, a seizure caused by fevers, and that's what they wrote in the note. And that's a common, thing that a doctor may do is listen to what a patient is saying and have to interpret what that means. But it's not necessarily a one-for-one transcript of the conversation. But with AI tools, that is all transforming in interesting ways. And documentation has gone through a lot of changes over the years, going from being written primarily on paper, where it still is in many places, but increasingly documentation is electronic. And when we went from paper to electronic documentation, in one hand, it was easier to read the electronic documentation. You don't have to interpret someone's handwriting. But one problem with the electronic documentation is it became a lot easier to make the notes much longer. You can just put the full list of all the medications, all the reports, whereas when you're on paper, because you're manually writing it, you tended to be more judicious and write less information, but more important information. So there's actually a lot of research and analysis going into just because we got to electronic information doesn't mean that the quality of notes is better. And in fact, it may be harder to find what you're looking for because there is a lot more information. And so, this is pre-AI, but as we're implementing, as we use technology to transform care delivery, it starts to change different processes, and we have to keep that in mind. And notes have many different purposes. They're, to help doctors remember, to help communicate with other doctors and clinicians. In the United States, they're used, as the billing record, as a legal record, and ultimately also for patients to help patients remember what they need to do, help them understand why their doctor is making the decision they were. And so when we think about notes and AI and where it all comes together, this is a general kind of overall schematic of what we're starting to see from the Open Notes lab. So we just took an example of a typical outpatient visit. And you have the cast of characters along the left, you have the patient, clinicians, and then you have AI tools. And then you have what may happen before a visit, during a visit, after the visit, and between visits. And for the patient, before a visit with their doctor, they may be preparing some questions they want to ask. They maybe receive a questionnaire that they have to complete. The doctor has to review the patient's chart, review the questionnaires they answered. And this is a place, what we're starting to see where the AI technology is coming in, is we're starting to see companies create AI chatbot-based questionnaires that start to engage the patients in a more direct manner. Instead of having just a decision tree-based questionnaire, you can actually now have more of a conversational chatbot that's able to gather all the significant details from the patient and then already present that to the clinician in a structured format that can help with their diagnosis. During the visit, while the conversation is going on, I mentioned the ambient scribe technology. You have AI listening into the conversation, and then after the visit, it can help the clinician write the note. It can help the patient understand the note, help the patient follow up. And then between visits, increasingly, doctors and patients message each other electronically, and now about 150 hospital systems in the United States actually use GPT-4 for the doctor to draft the initial message that goes to the patient. So the AI tool is looking at the patient's question, at their chart, coming up with a drafted message that the doctor then sends to the patient after reviewing it. And so these are many of the technologies that are going into place right now. And we're at the lab been interested in studying these. And we work to co-develop AI technologies through a patient lens, evaluate these tools for patient centricity, help to guide the implementation of them, and ultimately inform where this goes. And just wanted to mention there's so these are just some broad ideas of what AI can do for patients directly, simplify notes, language translation, help patients better plan for their care, connect to others, all through the power of AI. But what we're starting to see with generative AI tools is that they're very powerful for patients to use directly. They're very powerful for clinicians, for doctors, around a lot of the administrative tasks they have to do. And so we're seeing this alignment across what the patients need, what the doctors need, and some of the administrative tasks, such as writing notes. And I think it's one of the reasons that we're starting to see generative AI technologies be adopted so rapidly in healthcare systems, much more than many previous technologies. But there are still a lot of challenges with this. There's challenges around hospitals needing to validate these AI-generated summaries. These AI companies are saying that humans are in the loop, but that may not always be the case. And there's been some studies where they've interviewed physicians on what they think about the use of different AI tools in the clinical setting. And there are still a lot of concerns about the technology itself, but much deeper, if you look at the iceberg diagram, the technology concerns about, the accuracy of the technology, that is a concern, but there's much deeper concerns that are hidden, which have to do with more issues like, what does this mean for the doctor-patient relationship? Will a patient just be relying more on AI technology and not trust what their doctor says? Or if the doctor uses AI, does it mean the patient trusts the doctor more, or do they trust them less? And so there's a lot of interesting questions about what this means for the future of healthcare. And in the United States, we have these different coalitions. The biggest ones are CHAI and Health AI Partnership. CHAI is the Coalition for Health AI. And then there's also Raise Health, and there's a couple of others. But these are groups that are primarily formed as consortia of academic universities along with big tech companies, and they're trying to come up with the guidelines for the responsible use of AI in healthcare, although it's pretty challenging to get everybody in agreement on the same page, especially in a rapidly developing field. And the last point I want to make before opening it up for some questions. So, AI has a lot of promise in healthcare, but we're increasingly also coming up against an important question is looking at the environmental footprint of AI itself. Lot of data coming out about the energy use of AI. For example, a study shows one ChatGPT search uses about the same amount of electricity energy as 10 Google searches. And with the rapid advancement of AI, not just in healthcare, but across our society, we are starting to exhaust the energy requirements, water, because the AI is powered by GPUs, graphical processing units. They get very hot and need a lot of water to cool them down. And so companies like Google and Microsoft are now building nuclear power plants to be able to power a lot of the AI tools. And it's also throwing off a lot of the commitments these companies have made to be more sustainable, to reduce their carbon footprint. And so hospitals are in an interesting place because hospitals in the United States contribute a significant portion of greenhouse gases, about 10%. And there's been a lot of efforts to try to reduce that. And this was a roundtable discussion that I was part of, looking at the issues of AI in healthcare. This was during the United Nations General Assembly New York Climate Week meeting, where we're able to talk about this issue of healthcare AI and making sure that we use it responsibly and that we implement it in ways that are as sustainable as possible. We're starting to better understand the differences between the different models, and a lot of the proprietary models from companies like OpenAI and Google, a lot of the energy footprint of them is still hidden from the public, but there are some estimates that have come out. And depending on which model you're using, what data center you're using, what processors you're using, the carbon footprint of using AI can vary by 100 to 1,000x. And so it's not saying that we shouldn't use AI, but the type of AI we use can have a huge difference in its environmental footprint. And so that's some additional work that I do, have led a lot of work around healthcare sustainability, AI, electronic health records, and have also come up with strategies and recommendations on what healthcare organizations can do to think about their implementation of AI in a more sustainable way. And finally, just to close and bring it back to the human story, I just wanted to share a story from a colleague and a friend named Hugo Campos, who's a patient advocate. And he shared the story on a panel where we were together just about the power of large language models. He's a caregiver for his elderly father who is suffering from a skin condition. And they went to see the primary care doctor who gave them some recommendations for creams to use. And they tried it out, but it wasn't helping. His father was having a terrible rash, was really uncomfortable. And so Hugo took all the information from the doctor and put it into ChatGPT. But Hugo's also gotten good at telling ChatGPT in how to use ChatGPT, and specifically, prompting the tool to say, "You are an expert dermatologist. What do you think of my father's condition? Here are all the medical notes from their doctor's visit, from their primary care doctor's visit." And remarkably, it was able to actually give them some diagnostic suggestions and medications that could be purchased over the counter, because for them to see the specialist, to see a dermatologist, was going to be a 3-month wait, and his father was suffering. And so this was a powerful example of a patient advocate, caregiver using AI to help take care of their father while they were still waiting to see a specialist. And throughout, the United States, but really throughout the world, access to specialists, knowledge and care can be very limited. And so there's a huge potential for AI to scale that. But we need to make sure that it's being done responsibly, safely, sustainably, and really going back to the humanity at the heart of medicine, really thinking about what health and healing is all about, and it's those very human relationships. So thank you very much.
Thank you so much, Chethan. It was a wonderful presentation, and the story that you had at the end, I think, really bring it home, connect all the dots together. Any question from people in the room? Anyone? Yeah, maybe I can get started. One thing that I think always interesting about your work is how you take the sort of interdisciplinary approach, right? Like I don't thinking about AI and healthcare, I think is becoming more common, but bringing in the issue of sustainability and thinking about sort of the planetary health as well as the human health, I think is really interesting. I know that you have done a lot of work in this area. Is there any other project that are kind of addressing this that we might want to share? Yeah.
Yeah, thank you. Thanks, Pat. I didn't go into it too much in this talk, not to go in too many different directions, but there's a lot of work I'm involved with, but really many others involved at the heart of climate change and health. So here I talked about the sustainability issues of the environmental footprint of AI, but on the other side of the coin, it's how climate change is impacting human health. We're starting to see, increasing heat waves, increasing drought, flooding, a lot of natural disasters, changes in vector-borne disease, air pollution, wildfire smoke, changes to drinking water supply. As climate change gets worse, all of these different environmental factors are increasingly affecting the health of individuals, of communities, of hospitals. And bringing it back to, I think, AI and technology lens, what we've been exploring and asking is, how do we use technology and data in ways to help connect the dots, to actually help be more preventative and proactive in care. So, for example, if we know that there's going to be a heat wave, how can we alert individuals earlier? If we know that there's going to be poor air quality and someone, the individual patient may have a respiratory condition like asthma, how can we alert the individual patient to make sure they know what preventative steps to take, but also maybe their doctor needs to know to prescribe the right medication or right treatment recommendations, or to some of the public health agencies that can help. So we're starting to uncover much more of the mechanisms between different environmental factors and health issues. For example, one that's very unusual is that the medications that are taken for psychiatric conditions like schizophrenia can affect the body's ability to process temperature. And so there's a lot of large-scale analyses that show that when the temperature gets too hot, the condition that has the highest risk of mortality is actually schizophrenia. And it's because of the medications that patients are taking. And so researchers have identified about 60 medications that potentially need to be adjusted when the temperature is too hot. And so this has raised questions like, okay, in the electronic health record systems we use, can we bring in heat information and then use some type of predictive model, or you don't even need a predictive model, but more of a rules-based system to say, hey, if the temperature is too hot, you may need to consider adjusting this medication for this heart condition or this psychiatric condition, because if they're not adjusted, then they can have worse health outcomes. And so that's just a example of where climate change, environmental factors, human health come together, but in the context of the electronic health record and where AI can help.
That's really cool. We just had a flood in Thailand, so I think your project is greatly needed right now. I was also reading a book by Professor Susan Solomon called Solvable. She was one of the first person that identified the connection between CFC and ozone hole in the Arctic. And she talked about how we healed the planet in the past and how we can do it again. And I think it was really giving me like optimism, like for the future. So I think that's something that I think your work also really inspiring in that case. Yeah.
Thank you. Yeah, it's I think climate change is this very big problem that affects the health of the whole planet, affects all of us. It's easy to feel kind of hopeless and worried about it, but as soon as you start to take action, you realize that there's a lot of possibility. Action is really the antithesis to apathy. And so I think, yeah, the example you highlighted is really a great one of, we saw this great crisis of the ozone hole in the ozone layer, and it's a great example of humanity coming together and actually through our collective policies able to heal that hole.
Thank you, Chethan. Thank you for being with us. Right now it's almost noon in Thailand. I think it might be a little late in New York. So really appreciate it. Thank you. Another round of applause for Professor Chethan Sarabu. Thank you.
Thank you very much.
ครับเดี๋ยวเราจะ move ต่อเป็นวิทยากรท่าน